you called in, please make sure that you do not put us on hold, because then we get that elevator music for all of us to hear. So welcome to another virtual IED Task Force meeting. I am Dr. Coke Kumar, the Fresno County Department of Public Health Senior Epidemiologist, and will be acting as the moderator. Before moving into the agenda, I wanted to cover a few items. So if interested in COVID-specific updates, in addition to the CDC and the FCDPH website, the Fresno County Department of Public Health has a comprehensive website that includes the data, which I've gone over in previous meetings, other resources, provider guidance, communication and media tools, as well as general updates for COVID. Now, please note that in 2021, we may be switching our COVID-19 database systems, which will impact what we are able to report on, and also may impact the look of our dashboard. Please note that when you go to our current dashboard, if you are looking for data, make sure to check the additional surveillance and mortality tabs on the dashboard, which really give a deeper dive into our data. And do know that although we would love to expand what is reported on, it is dependent on what data is able to be collected by our investigators. Also, I would like to point out that when kind of making decisions, please don't base those off day-to-day changes. It really should be looked at on a longer time scale, since those day-to-day changes may simply be associated with the random fluctuations, as well as reporting changes when it comes to labs, providers, as well as staffing able to process those reports. Additionally, the Fresno County Department of Public Health runs several briefings. If you don't already know about these, they're run for different groups such as medical providers, local government, CBOs, etc. And they do provide frequent COVID updates on those. If you're looking at information for other diseases, the EPI program has a website that does publish these disease reports, and we do have a flu tracking database, which we will go over today a little bit. And for the non-pandemic diseases, do note that reports are done after enough time has gone by to capture complete reporting and the data has been cleaned. So these will be more delayed than what you see for more pandemic data, which we're trying to get out as quickly as possible, and we'll have more variation. It's much more subject to change with COVID. Do also note that the EPI program is working hard to fill some current vacancies. While this occurs, especially given COVID needs at this time, reports might be limited and also will be a greater delay to get published. So on to kind of the IED meeting, I did want to briefly discuss the kind of purpose behind the IED task force. This meeting really shouldn't be used as a replacement for briefings, which there are already several of, or even a seminar series by the county. But instead, I think we should really try to focus on being a true task force. To achieve this, we really need to work towards stronger participation from all agencies involved, so we can develop more complete pictures of what's going on in our community and really strive towards having more actionable items. Also, as I'm sure is the current trend with all other agencies and all others on the phone, due to the increased COVID responsibilities, the county staff simply do not have the ability to kind of keep creating PowerPoints or presentations like we did in the past at this time. So I'm really going to encourage all members to think about what they could possibly contribute to future meetings, so that we can really get the most out of these, and that they're not just kind of these Q&A sessions, which are helpful, but see what we can possibly expand on in the future. For today, from the county side, we will have two brief updates. The first is going to be a flu update from epidemiologist Matt Middleton. And then, as some of you may have known, the previous CDI supervisor, Mary Morrison, has now become the new division manager for our new county COVID division. And fortunately, we have been able to get Natalie Adolph to take over the CDI position. So she will be giving some CDI, communicable disease investigation updates. So after that, we can move into just the general Q&A for everybody to participate. Matt, are you ready to give kind of a brief flu update since we're early in that season?
Yeah, I'm ready to go. I'm just going to share my screen here when you're ready. So,
Perfect.
okay. Sorry, I'm looking for my screening to share. Let's see here. I have Internet Explorer open, but I don't see my windows. Do you have anybody have any suggestions for me?
I'm not used to using Zoom. Any Zoom people?
Yeah.
Hey, Matt, once you hit the screen share button, it should pop up a whole bunch of windows,
Yeah.
smaller windows. You just have to select the one where you can select any of them if you know where you can navigate that page to. So as long as you click on any of those windows, it'll just bring whatever is up on that window, and then you can navigate to the flu page or whatever page that you may need to go to.
Okay, let me see if I can do it this way. Hold on. Can everybody see that screen?
Yes.
Okay. Okay, sorry about that. Good afternoon, I'm Matt Middleton, and I help with the influenza surveillance at Fresno County. And so good news is there's not a lot of flu activity right now. It's just what we need is a lot of flu right now with COVID going on. But the good news is there's not a lot of activity. Obviously, this is the beginning of the flu season, so that could very well change. So that's just another reminder that we all should get flu shots this year so that we don't have a lot of influenza and potentially COVID going around at the same time. This report is published every Friday on our county website through our immunization program. So if you go to our public health website and go to community health and our immunization program, you can find the flu data there. So this report is through September 27th through December 31st. So I'll just begin with reporting on any deaths that we've found locally in California and nationwide. So in Fresno County, we do not have any deaths due to influenza to report at this time. In California, there is one death that's been reported. It's an individual that was over the age of 65. Those are all the details I have about that particular case. And nationwide, as of December 31st, there are no pediatric deaths reported. For the 18 to 64-year-old age range, there are 11 deaths and 29 in the age range that is above age 64. And then moving along to subtyping information, so where we look at flu A and flu B and try to determine the particular subtype that we're seeing. Right now, it's just really too easy or too early in the season to see the particular subtypes. So this graph is showing the subtypes by the national region 9, which includes California, Arizona, Hawaii, Nevada, and California. And these largest bars here are, this is A, flu type A, that where subtyping hasn't been performed. And then this is flu type B, subtyping unspecified, or excuse me, lineage unspecified. So for all these regions, there's not a lot of subtyping data yet, likely just because we're really early into the season. We've just gotten started. For the subtypes that we have seen, there was looks like some flu A, H3 nationally seen, and some H1N1. And then we've also nationally seen some B Victoria reported. Last year, as if you're curious, the predominant strains were B Victoria. We actually had a little bit early B show up in the season, followed by H1N1 PMD 109. So those were the predominant strains that circled last year. So yet to be seen whether or not that will repeat or we'll have a different subtypes moving through the population. This is for Region 9 specifically, and again, that includes California, Arizona, Hawaii, Nevada. Again, not a lot of subtyping data available at this point. This is by disease week, and so the dark blue is the B lineage unspecified, and this lighter kind of color is A subtyping not performed. And just during week 43, they reported one case of AH3. So moving forward, and then we don't have any specific subtyping information for Fresno County at this point, again, because we're very early in the season. As we continue to progress through the season, this data will populate, and you can come to this webpage and see what's being reported more locally. And then moving to the last figure here, this is showing the percentage of emergency department visits that are due to influenza-related illness. So this looks at our emergency department visits and determines if somebody was visiting the emergency room because of influenza-like. This gray bar here is our alert line. So during 95% of the time, percentage of ED visits due to influenza-like illness are either at or below that line. So when we start to see it surpass that line, we know that the burden is higher than expected. The average line is this kind of tan line here. So you can see average during prior seasons, and the average line and alert line are calculated based off of prior seasons data. So those are what we've seen from prior seasons. And then this year's current data is here, the solid green line. As you can see, we're below normal for this time of year, which is a good sign. From week 43 to 44, we did have a slight increase in percentage of ED visits due to flu-like illness, but still low. But I should also mention here that because COVID-19 and flu do have similar symptoms, this syndrome could mix flu with COVID-19. And that's an imperfection of this reporting. But as of now, as we monitor this, we are below normal activity with COVID in Fresno County. And you can actually see from last year when COVID, when we started seeing more COVID in Fresno County, we had quite a large spike in ED visits due to COVID. It doesn't mean that we had more cases of COVID. It just means that there was, we think, a lot of people seeking care because of COVID, because of concern. So at that point, I'll pause or anybody's questions they might have.
Any questions for Matt? Great, thank you, Matt. Appreciate that. I think this would be a good time to also kind of really push that as a county, we really need to focus on encouraging people to get that influenza shot, vaccinate. Also really encouraging that we get especially school-age children to be vaccinated for the common vaccine preventable diseases. We haven't been able to look at this county level, but they have seen state level that those have dropped. And so we really want to push that forward to make sure we don't really lose that momentum we had going for the other vaccine preventable diseases. So just really let's encourage those whenever you can in your populations. Natalie, are you available?
Yes, hi everyone.
Perfect.
Yes, Natalie Adolph here. It is a pleasure to virtually meet everybody. And I'm gonna go ahead and take this time to share my screen now. So let me override here. Okay, perfect. So as mentioned, my name is Natalie and I'm the interim supervising public health nurse of our communicable disease investigation and childhood lead poisoning prevention programs. So our focus today will be on our communicable disease investigation, also referred to as CDI program. So this transition happened in July. So in July, we decided to kind of separate the COVID-19 investigations from our other communicable disease investigations. And so with that break that happened, just because of the sheer volume of COVID-19 cases, we created this whole COVID-19 division. And so with that, Mary Morrison became the division manager, and she was the previous supervising public health nurse of our CDI program. And with that, she also took 2 of our seasoned communicable disease investigation specialists. They were moved to the COVID-19 division to kind of lead our more high-risk population teams. So I'm sure you guys might have been familiar with Norma Sanchez and Angie Perez. And so they are leading our congregate setting and our academic setting medical investigation teams for our COVID, and they're doing a phenomenal job. But that definitely took a hit for our communicable disease investigation programs. So now our team consists of 1 public health nurse, 1 office assistant. We have 3 communicable disease specialists that are seasoned, and we just hired 1 brand new specialist. So we're definitely still able to manage all of the cases that are coming in and investigations coming in. I have full confidence in our team, and we're definitely learning together, growing together, and making sure all the needs of the community are met. So with all of these communicable disease investigation, what does that look like? They run investigations for over 80 different reportable communicable diseases, and they're able to touch base with our community for prevention, education, and preventing future outbreaks, hopefully, as much as possible. So I wanted to bring our attention to our communicable disease investigation program Fresno County website. I think it has a lot of good information about what our program consists of. And our office is located downtown in the Bricks. And so it has our address, our telephone number, and fax. We are reachable Monday through Friday, except for holidays, from 8 to 5. We do recognize that communicable diseases do not rest on holidays or weekends or after hours. So my staff does have a rotating schedule for on-call hours. So those on-call hours are for emergent issues that come up. So if there's any communicable diseases that have to be responded rapidly, if there's an outbreak of bioterrorism, something that we have to respond to immediately, we do have after hours. And so those calls typically go through our county dispatch. I do have that phone number, so if you wanted to write that down, our county dispatch number is 600-3111. And when those calls come in through our county dispatch, we have an emergency response team that kind of evaluates those calls and make sure it gets to our communicable disease investigators if applicable. So we want to make sure that our community is supported 100% of the time. So on here, it kind of has all the information that you might need to know. So it has kind of the infectious diseases that are of most concern for us. So we kind of trigger our red flags: meningitis, measles, botulism, bioterrorism. And this website will link you for more information on each of those different communicable diseases. So I do encourage all of you to explore our website. I also want to touch base with on here is like healthcare providers following here, because we work closely, our communicable disease investigation program works very closely with our epidemiology program, because one of the most common questions we get is, what kind of diseases are we getting here in Fresno County? What are our disease statistics? So within our epidemiology page, we can actually find our statistics webpage, which is found here. So when you pull this up, it has like the list of reports. And as Dr. Stephanie Kokumar mentioned, that we have to make sure that we have the most accurate data. So we have to make sure that we wait for all of the disease investigations to be finalized, and different with our pandemic happening, some of the reporting is a little bit on the slower side, but we do have Q1 of 2020 up. So I will go ahead and pull this up. And this is kind of an overview of selected communicable diseases. Even though our communicable disease investigation is separate from the sexually transmitted diseases, we still have those up here. And it's kind of a comparison of our Q1 2019 cases versus our 2020 cases. So some good news is most of our communicable disease numbers went down, but as you can see, some of them also were on the rise. For example, we had like a mumps outbreak So we see we had some mumps cases beginning Q1 2020. So it kind of gives you a good overview of some of the common communicable diseases that we see in our area and during the time. And so for right now in November, October, November, we had a spike of our West Nile virus cases. So once we have those updated numbers, again, you can continue to check these statistics and you'll be able to get those accurate updated numbers. So I encourage you all to check that out. So I keep talking about communicable diseases, 80 different ones. So I'm not sure if everyone's familiar at what are communicable diseases, which ones are reportable, and how is that mandated. So again, we have a handy dandy reporting requirements page. So if you click here, it'll take you to our reporting requirements. So this goes over, the reporting of specific diseases are critical to our public health and are required by law. So Title 17, California Code of Regulations, Section 2500, Division 1, Chapter 4, Article 1, requires all healthcare providers knowing of or intents of a case of a suspected of any mandated reportable disease or conditions to report the case to our local health department, which is us. So we have a list of the reportable conditions found here. So I encourage all of you to navigate, because I know I'm navigating this pretty quickly, but I do feel like the flow is there and you'll be able to navigate it without too much difficulty, but you can give us a call if you have any trouble. So on here, it has the list of reportable conditions and then the urgency. So how quickly do you need to report these conditions to the public health department? So as you look through here, you might be seeing all these different, symbols. So for example, measles, let's go to that one. So the urgency, there's a little phone and an exclamation point. You just reference up here, and that is to be reported immediately by telephone. So we kind of use this. And so this is a list of all the different communicable diseases that are reportable within Fresno County. And just to let you know, again, as we mentioned, they're reportable by law. So failure to report these is a citable offense and subject to civil penalty. So again, we like to work with our community, provide education and support, and make sure everyone has the information they need in order to report these communicable diseases. So with that, how do we report? So again, our Fresno County website is really good about breaking it down as far as the steps. But again, a lot of times you get in there and you might have questions like, okay, how do I do this? I know, like, I'm on the website. You can always give us a call and we can kind of walk you through. So in order to report these communicable diseases, we have the CMR form, which is the confidential morbidity reporting forms. And that's for all diseases and conditions other than COVID-19, tuberculosis, and our DMV, so Department of Motor Vehicles. We do have those as well, as far as reporting like STDs, reporting for TB reporting, and the DMV as well. We have a breakdown of the COVID-19 reporting, and I just want to mention that we do encourage, even though we have these forms, which are hard copy forms that you can fax into us, we really do encourage everyone to be familiar with our CalReady confidential morbidity reporting, because all of it can be electronically reported through our CalReady system through a provider portal. So I do encourage everyone, if you're aware of providers that may not have access to this, going to the CalReady web page and creating like a provider portal account and requests. So one of the communicable diseases that we do follow up on that is not in CalReady are animal bite reportings. So we do work very closely with our epidemiology program to create this red cap form where you can report electronically rabies report forms, and we work closely with environmental health and our communicable disease investigators to follow up on these reports. So I do encourage everyone to kind of check out this webpage and get familiar with the reportable diseases investigation and all of that. So that was kind of my update. I just really wanted to show around, make sure everyone knew that, yes, COVID-19 may be taking up most of our time, but there still are definitely other communicable diseases out there that are on the rise, and we're making sure we're following up with the community in a timely manner and making sure that we stay on top of those. So as Dr. Stephanie Koch-Kumar mentioned, making sure that our children are being vaccinated and making sure that they're going to routine doctor's appointments and making sure that we're still following up on these things. So any questions for me?
Well, maybe people are thinking of their questions. I will add that we have seen a couple cases of St. Louis encephalitis. We also have seen some reports from the state level, not Fresno County, of disseminated gonococcal infection due to untreated gonorrhea. So just some things to be on the lookout, since we are seeing in California those start to pop up. And are there any questions for Natalie? Okay, all right, so let's move on to our Q&A session. What I want this to be is not just the county answering those questions, because I know that there's a lot of expertise on this phone that can overweigh my own for certain topics. So please speak up if you have an opinion or an answer that can help, so we can just kind of move into some of those questions that people may have related to either COVID or other diseases at this time. If there are any. And if you have one, please make sure that you unmute yourself.
Hello, my name is Abram. I'm a CDI over here in Madera. And sometimes when we're looking for 700 cases, we really don't know who to reach out to if it's strictly 700, or if we're looking to speak with someone about 900. We would like an open conversation, or who do we reach out to in Madera County?
So are you asking, my microphone went out for a second. Are you asking for Madera contacts, or are you asking who would the contact be for Madera to talk to Fresno County?
To talk to Fresno County.
Natalie, do you maybe have the field this one?
So we do have the line. So if you call our communicable disease line, we have, right now it's kind of a phone tree as far as if you're calling regarding a communicable disease. So, and it depends on if you're calling during business hours or after business hours. But if you call our main line, as I mentioned on the top page, it will be routed to our communicable disease investigation and whoever's on office duty. So if you call the main line, we have specific investigators that are assigned that work specific hours, what we call office duty. So they field all the calls that are coming in. So let me give you that main line. I think that's probably your best bet when you call in. So that's the 559-600-3332. And let whoever is on the line who answers that you're calling regarding a reportable communicable disease, and they will get you in connected with our communicable disease specialist that is working that day. So it does rotate.
Thank you.
You're welcome.
Thank you, Natalie. Any other questions?
And great question. Since we're talking about it, is there a number that you prefer us using for Madera County? We do have the main line that we utilize, but if there's another number that we should be utilizing, I'd love to take that from you.
Our number, it's the same way. You just call in and you would just ask for it's myself, or we have a couple other people, but it's the number here is 675-7893, and you would just hit option 4 and they would direct you our way.
Okay, so yeah, you have the phone tree too, where you have to like listen in and find the option. Yeah, okay, perfect. And it's nice to meet you. My name's Natalie, and your name is?
My name is Abram Garcia. I'm a CDI here in Madera County.
Well, very nice to meet you, Abram.
Any other questions or topics of discussion that people maybe want to bring up and the group at large?
Well, since this is my first meeting here, I would like to hear what organizations are on the line, if anyone's open to unmuting yourself and like letting me know where you're from and if you have any updates that you'd like to give.
That would be great. Yeah, typically in the office, we introduce everybody in the room. It didn't work very well over the phone, so we didn't at the beginning of this one, but that's a good, I think a good thing to do now is see what groups are in this specific meeting.
Let's see.
So I know we typically have some people from the school system. Do we have anybody on the phone from that group?
This is Jeannie Prandini from Clovis Unified School District. Thank you.
Great. Thank you. The jail system?
I'm from the Fresno Health Department, but I'm like the IT specialist working on the immunization for PrEP mod.
Oh, good.
But yeah, I don't know if that helps.
Welcome. Do you have any, I know we have some local healthcare providers and groups.
Hi, this is Karen Dahl from Valley Children's, one of the infectious disease physicians here and helping with our COVID response.
Wonderful, thank you.
Hi, this is Robin with Madera County Emergency Preparedness Program and helping with mobile testing and flu as well.
Do you have any mosquito abatement on the line?
Yeah, this is Colin Reese with Fresno Westside Mosquito Abatement.
Do you have any maybe updates on your end, Colin?
Sure. Most of the Fresno agencies are starting to wind down for the season, so mosquitoes are dropping off. Turned out to be sort of an average year as far as disease activity. Last year was kind of a peak year for both human cases and mosquito activity. So this year fell in line, I think, for most agencies as a more average year. And expansions of invasive Aedes throughout Fresno County for sure. It's pretty much universal now that we have the Aedes aegypti. There was a reduction in travel-related cases for Zika, dengue, chikungunya, partially because of the shutdown of travel. But we expect if that picks up again in future years with the massive expansion of the invasive Aedes, we'll have to keep an extra close eye on that. Other than that, pretty much a standard mosquito year.
Thank you for that.
Hey, Stephanie, it's Ryan McNeil from the Fresno Mosquito and Vector Control District. Our year was the exact same as Conlon's. In our area and in the eastern part of the county, I will add that we are seeing quite the resurgence of St. Louis encephalitis virus. We had one case here in Fresno County, one case in Madera County. The Madera County case was unfortunately a fatal case of the virus. And it looks like we may have some more, quite a bit more of that virus here in the near future.
Thank you for that. Something that definitely we need to keep an eye on. I know at the county level, we definitely at the health department are keeping an eye on those cases because it's something we are concerned with. Any other groups want to give an introduction or any updates that people want to share of what they're possibly seeing in their groups? We did have a question of, are you seeing an increase in flu vaccination this year? So I will say that this is something we are currently trying to look into at the county level to see what kind of trends we're seeing. So we're looking into trying to find that data to get access to the data. They have seen, some other counties have reported they've kind of seen fluctuations. I know San Diego County had seen a peak and then they went down a little bit. Now they're going back up. So they did actually see increased flu vaccinations. We are hoping that our county also, with the push with the pandemic, that we will also see those increases this year is the hope. But we really unfortunately do not know at this time. We do know that things have changed of where it's available, but there is a lot more drive-through availability occurring. So hopefully that will also encourage participation. So once we have more information, we will be putting out reports associated with those. Any other questions? So are we seeing a uptick in HIV? It seems that more babies born with HIV positive mothers in the past few weeks here. This is something we have been looking into because there was more HIV associated with some drug use that had come up. So it is something we're currently looking at to see, is it actually an increase trend or was it just kind of a random variation? But it's something on the county's radar. Has anybody else possibly seen anything associated with HIV, or is anybody from the STD program on the line? Okay, well, something we are also looking into to see. I will note with all diseases, as had shown on the communicable disease report, you did see some had decreased. The question there is, did they decrease because possibly of prevention methods, possibly people not going out as much, or is it more of a problem of people not seeking care, not being tested, not being properly treated? So that is a concern that we've had, is that although reporting went down, we are hoping that next year we don't actually see spikes due to more late diagnosis of a lot of these cases. So something we are keeping an eye on, that we're definitely concerned about, but hopefully it was some true decreases in some of these diseases. Any other maybe discussion points or questions that people want to lead? I know there's a lot of good expertise on the line, so would love to hear from some of you. All right, well, if we don't have any other maybe discussion points that people want to lead or questions, then we will call this a short meeting, but I hope that, so we get a little more participation in future meetings, that people think of what they possibly could share on or contribute maybe to the next round when we have the meeting next time, see what we could possibly discuss. It could be either leading a discussion question, maybe you have something that you want to hear from other groups, or you just want to share maybe something that you guys are doing, something that's working well for your group, something that you've struggled with. Any of those topics, please share them with us so that we can get them on the agenda. And I will give one call out for any questions or discussion points that people want to have in this meeting.
Hi, this is Robin with Madera County. I did want to add, we have been adding our COVID testing, has been doing COVID testing and flu shot together because we weren't seeing much of an increase in our COVID testing. So when we added flu, you can come through and get a COVID test and flu if you don't have symptoms. So it turned out to be good for both. We got an increase in both flu and COVID testing when we added them. So I just thought I'd throw that out there.
Well, that's an excellent idea. We can get them both up. That's going to be beneficial. So that's great. Do you know if you saw a lot of people that were willing to do both?
We did get a bunch of people that were willing to do both. Yeah, with a little bit of convincing, like, hey, you're already here and why not get the flu shot? Some were coming for COVID and we steered them the other way. Some were coming for flu and we steered them the other way. So we made it as easy as possible.
Right. Anyone else? Okay. Well, thank you so much for attending, and look forward to hopefully some more discussion in future meetings. Thank you.
Thank you.
Have a good day.
Bye.
Entering the community to be screened for signs and symptoms of possible exposure to COVID-19.